Thank you for this nice invitation. My name is Amal Omari. I'm the Chief Scientific Officer at King Hussein Cancer Center in Amman, Jordan. In this capacity, I lead the Office of Scientific Affairs and Research, which is the main administrative body responsible for managing all research operations in the center. Under the Office of Research, we have our hospital-based cancer registry, where we collect data on every case diagnosed and or treated at our center. We also have a Center for Research Support Services with a dedicated clinical trials unit to support pharma-sponsored and investigator-initiated clinical trials. Also, biostatistics unit, data management unit, survey research unit, and research training and education unit. All of this for the support of our researchers. And we also have a Center for Grants and Contracts Management that manages all the work related to our funded research projects, whether intramurally funded or extramurally funded.
Thank you. And what are the key challenges you see in advancing cancer research in the MENA region?
I think it's about creating the right research environment. So we've done this at KHCC. So when we started, really the number of active researchers weren't that many. But we started advocating for research, having research training and capacity building workshops related to basics of clinical research, how you start your research project, how you find the right idea, how you write up your paper, how you publish it, how you choose the journal. And also we started having incentives for researchers. And so we started growing our research program. So I believe by seeing the value, this is the best way to market research. So the value of research can be by having a career in research, like impact on your own personal career journey, but also when you're treating patients, especially in low middle income countries, and you know that research can be a way of availing and having access to drugs that are not really available in our region outside the research enterprise. So, and that's why we also always want to increase the number of clinical trials in our center, because as I mentioned, it's our way of availing new drugs that are not available to our patients otherwise. So I think by seeing all that value, you can actually starting to increase your tribe, like increasing the number of researchers interested, increasing the active researchers, increasing the research output in terms of number and the quality. So by having more publications in high impact journals.
Speaking of clinical trials, how would you improve access to clinical trials when it comes to patients?
Well, actually, you need to do that by networking with the key stakeholders, whether on the national, regional, and international level. So on the international level, we have to have good relations with pharma, because they are the biggest sponsors of clinical trials, especially clinical trials that bring in novel new treatments that may not be available otherwise outside the research enterprise, but also having a good network of collaborators also, because that's our way of doing our investigator-initiated clinical trials. Investigator-initiated clinical trials can answer research questions that the pharma may not be interested in pursuing. So both have their advantages, the pharma-sponsored trials and the investigator-initiated trials.
And how can innovation in science and technology bridge gaps when it comes to cancer?
Again, so it would be research, I think, because with research, you generate knowledge about the disease that we have in our area, about the type of patients that we are treating. Maybe we have special, unique characteristics that are different from patients in Western countries, in Asia. Also bringing new drugs, as I mentioned earlier, and also leveraging new technologies. For example, the innovations that are happening in data science, in the digital world. So maybe also telemedicine can be a way also of bridging gaps in care, having access to patients who cannot actually reach hospitals or reach advanced cancer centers through telemedicine. I think these are all ways of how technology can bridge the gap, especially in our low middle income countries.
And how can regional and global collaborations contribute to addressing disparities?
I think I kind of addressed this in my earlier talk. So again, having the right collaborations, whether with the private sector, the pharma, or with active research institutions, active researchers, in order to generate knowledge unique to our region, bring in new drugs, and all this can be done through like having the right research collaborations.
So do you think that advancements in science and technologies are also addressing disparities?
Probably not to the extent that we'd like. We'd like more focus on low middle income countries. You know, if you explore the scientific literature, you'd find that most of the publications and the science that's being generated is actually addressing issues related more to Western countries, more than low middle income countries. So I think we need more focus on our region and on Arab countries in particular, and on low middle income countries in general.
And how would you achieve that?
By again advocating for more research, more impactful research, more impactful collaborations in the research world to be happening in our region and between our Arab countries.
Do you think that NGOs can play a role in that?
I do believe that NGOs can help. NGOs can help by actually probably finding resources for funding, by advocacy, by helping increase the awareness of the public about the value of research, the value of clinical trials, and why this is important to our region and to our patients.
And to conclude, if you could implement one major change in cancer care today, what would it be?
I think it would be making new drugs and new innovations affordable and accessible to our patients, because many of the new drugs just are not available in our countries and in our region because of the high cost. So probably that's the main thing that I think I would do.